afternoon and welcome to United TV. I'm Kemal Erkan and thank you for joining us. Today, we are pleased to welcome Delaware State Senator Dan Cruce, who represents Delaware's 1st Senate District. Before joining the Delaware Senate, Senator Cruce built a career dedicated to public service. Today, in addition to serving in the General Assembly, he is also the Chief Operating Officer of United Way of Delaware. Now, let's not confuse that with United Medical. Helping lead programs that connects Delawareans with critical health and human services, including Delaware 211. Today, we will learn more about Senator Cruce's journey, his approach to public service, and discuss some of the biggest opportunities and challenges facing Delaware. Well, is it okay to call you Dan?
Absolutely. I'm not a formal person.
Thank you for being with us. So it's great to have you. We met, I believe, only once in one of the events. Didn't have much time to talk, but I'm glad that we are able to get together.
We made an impression on each other, so that was good.
We did. So I know you have a really important seat because right before you, Sarah McBride was there. She's a good friend, and she's doing a really good job in the Congress. And glad to see you in her seat. And we want to get to know you a little bit before we talk about the policies, other stuff. We know that you grew up in Virginia.
Yes, the twang will come out every now and then. If I'm a little extra tired, you'll hear some y'alls come out of my mouth.
So that's all fine. Now, you came to Delaware for law school.
I did.
And never left. Actually, you and I, we have some similarities in terms of that. So the only thing that I had a longer trip, I came from Turkey in 1998 and never left. So
you get it.
We are kind of Delawarean by choice, which is, I think, more important. So did you always see yourself in the public service?
I did, but I don't know if I manifested that in a sentence in my head through my life. My mom and my dad were both involved in their own ways. My dad led our local city, the city of Portsmouth, the Redevelopment and Housing Authority. So that had him and sometimes me on my mom's knee out at public board meetings, public commission meetings. So it was kind of ingrained in me subconsciously from a very early age. And my mom worked at the local naval hospital. So the idea of service and community and helping people was just around me my whole life.
So now you had a choice to make a lot of more money, but you went into the nonprofit. You're a lawyer, right? So how is that decision-making process? I want to kind of understand that better because you could easily make 2-3 times more than what you are making today. So why did you actually choose this? Are there other motivations, maybe satisfactions, rewards that you are getting?
Yeah, I will tell you, I joke a little bit and I call myself a recovering attorney, which makes everybody ease a little bit. I am so proud of the degree that I have and the career that I made, and I use that skill set every day. But I realized early on that there was just a different calling for me. I had a couple of traditional legal lawyer jobs, starting in family court, which was a phenomenal experience, all the way to federal court as well. But there was some other calling. Again, like I said before, I didn't know what it was. It wasn't a sentence in my head. But what actually crystallized it for me, and you mentioned earlier about how we both came to Delaware. We're not from Delaware, so we can't talk about the Friday night high school football game. It's a very Delaware thing. But when I came to Delaware, I fell in love with Delaware, and then I fell in love in Delaware. So two distinct but related things happened, and the person that I fell in love with was a teacher. And that person is now my spouse, Bart Dryden, and he was a teacher, then an administrator. But when we first started dating, I was still in the general practice of law, doing those things, and I got to meet his friends, and I got teacher friends, and I really got to understand what I now truly believe is the most important profession in the world. Educators, teachers, adults that we give our children to say grow them, raise them for us during the day, educate them. And those experiences, meeting his friends and seeing what he did as a career, turned a spark on with me. And I didn't know what my calling was going to be, but I very soon thereafter made certain that I found my way into the public education setting at the local level, I was the deputy superintendent and chief of staff at the school district level. Same type of role at the state. I was the deputy secretary and chief of staff at the Delaware Department of Ed. And then I got a chance to work across the country with different teachers and teachers unions and associations in 15 plus states. So meeting him and his colleagues and his friends actually helped me get to the phrase of recovering lawyer, and I've never looked back.
No, that's good. Well, so we make choices, and I think sometimes people um, maybe exaggerate certain things. Maybe they make too much out of life. So like we just need to really go through this, and then we don't need not everything needs to be perfect. So
Right.
Delaware initially wasn't the most desirable choice for me, but once you find out where you actually really make your earnings, right? So if also like if you are comfortable with where you are, and then how close you are. Like if I have friends who live in New York, uh, they they make maybe similar amount of money, and they live in very like small little
Cost of living is a real thing.
like it's the hostile almost like I'm
Right.
like why, and like how many times do you need to go out every week? So you're still able to do those. I mean, Philadelphia is only 30 minutes from here.
And we don't even need
DC,
Philly. We've got a
we
booming
we
downtown.
don't
We've got
actually right
great little
now.
small area, Trolley Square.
Absolutely, absolutely. Actually, there's like this new Mediterranean Turkish restaurant by the Bardea people.
I saw that.
Esme. I was there last week.
I'm pretty
So
much vegetarian vegan, so I cannot wait to check that
they
out.
have good options there.
Yeah.
I mean, it's not like just the regular Turkish food or whatever they want to call. So they don't want to call it just Turkish, but uh, it's more like the interpretation of the American chef
Sure.
doing
Well,
Turkish
I
and
need to
other
go there with
Mediterranean.
you, and you can
Well, yeah, I mean,
move me around the menu.
I was there with one of my friends last week, and it was fun. But you're right. So the Wilmington is getting much better, much better than 25 years ago.
Sure.
So now I want to give you a little bit background on what United Medical does.
Yeah.
We are an accountable care organization, and one of the reasons that we start doing these YouTube, like many people now they think that all I do is YouTube. So I just want to take an opportunity and then just say that no, this is only 2 hours a week. That what we do, maybe like 1 or 2 hour prep. But my real job is I'm a healthcare executive, and we own medical offices, we own surgery centers, specialty practices, and then many of them we also provide services if you don't own them. And we are one of the first ACOs in Delaware back in 2016. And at the primary care level, we have about 115,000 patients, unique patients that we provide services, close to 440,000 appointments in a year.
Wow, busy.
So, and because we are not a nonprofit organization, so the hospital systems and others, the fee schedules and the way that certain things are already set up, we are not taking actually, we are not on the advantageous part of the healthcare. So we have to always work much more, 3 times more, 4 times more to make it. And with the physician shortage and other healthcare provider shortages, this is a real problem. So with having 115,000 primary care patients in our system, that also gives us a really good and important responsibility, and I take this very seriously. So we started during the pandemic with being able to reach out to our patients, and in some of the cases with our employees, because there are a lot of remote people during the COVID time. And now we are almost 305,000 subscribers. We are probably one of the biggest, not just in Delaware, probably in the Northeast in terms of the healthcare. Now, I don't know how close to YouTube community and how closely you are following, but building this without smashing egg on the other person's head, it's difficult. So we are making this with serious conversations, and healthcare, politics, economy, and global affairs. Like this week, actually, I did 2 special sessions with NATO summit in Turkey, and uh, it's not easy. But the reason we are doing it is because we want to make sure that we can actually voice our opinions and issues, and you are
Hmm.
part of that because you are one of the policymakers for us. Now, the healthcare is important, and providing healthcare as an employer is uh, 5, 6, 7 times more expensive than it was 10 years ago. And it seems like it's just increasing and increasing. And just so that, that's kind of that background will get me into our healthcare side of this conversation. So, do you think there's enough prevention initiatives
Hmm.
in healthcare? And do you think there are other things maybe you are already working on? We just passed the Senate Bill 1. Thank you for that. And that was important, but many people didn't understand. We had to fight for it. And that fight wasn't an easy one because
At all.
we have the hospital system on the other side. I don't know if you were there that day at the hearing in the House. I was just there with a couple people also from medical society and us, and 90% was the hospital systems. So, uh, what's your position on the prevention initiatives? Do you think there's enough in Delaware?
Yeah, a couple of thoughts there. Senate Bill 1 was incredibly important because at the end of the day, what got across the finish line, it was a we.
Mhm.
It was the systems and it was the policymakers and it was you. It was a
Right.
group of folks, and I think
Mhm.
that's important because what we accomplished. And I know I'm talking code when I say Senate Bill 1, but the bill that we're talking
Mhm.
about, it's not just what the words in the final version of the bill and the amendments. It's what I just said. It's the folks that walked across the finish line together because we've got more work to do with hospital
Mhm.
systems, not against, not
Right.
for, but
Right.
together.
Absolutely.
And I don't know if that got enough coverage because that's symbolic of how we are trying to lead in the Senate Democratic caucus as well. Not every decision is easy. Not every policy or bill that we want to move is a slam dunk. But the how we do things, I think, is incredibly important. So I wanted to make certain that I shared that as well. The direct answer to your question about prevention, I'm so glad you brought it up, is no. We do not have enough.
Right.
And shows like yours and the viewership that you've built, you should be very proud. And like you said, in a day and age
Mhm.
when you're not starting fights and arguments, we're having
Right.
productive, intelligent, fun, but informative conversations. There's
Mhm.
an appetite for it. And this is part of that. I think part of the story that needs to be told more broadly is, what do you mean by prevention? What do I mean by prevention? Preventative care. I mean,
Yes.
these are phrases that they're not just policy phrases, they're not just industry phrases. What you're doing with your viewers helps to socialize what we mean by that, because investments on the front end
Mhm.
reduce expenses on the back end, which has an effect on how much we pay for something like healthcare. And not just preventative or some of the maybe the traditional views of preventative. For me, I'm also thinking of preventative care from a mental health perspective,
Mhm.
not just a physical body perspective.
Absolutely.
Although your
There.
brain is part of your
Yeah.
body, I get it, but sometimes we don't look at the social indicators of health.
Mhm.
And that's a long phrase too. Sometimes we unintentionally talk in jargon, but the things that can keep us well
Mhm.
and happier and stronger are the things that keep us out of the hospital system more often than not. So those, we do not have enough investments in that area. But I will tell you what we've done a fantastic job of is in the public education, like your public school perspective, and in our culture in general. We're talking about this. You're talking about this. The more folks that recognize it, that are regular, everyday, hardworking
Mhm.
families, the better, because they'll start demanding it in some ways. And that helps when we run legislation or when we have these types of conversations.
Right. I think you said a lot of important things. And one is, I agree with you. We do need the hospitals. We are not fighting against hospitals. It's the what differentiates our disagreements, or the reason for our disagreement is, there are primary care services, outpatient, and there's inpatient services. So when you have an emergency situation, of course, you're not going to go to your primary care's office. Uh, when you have an emergent surgery, you are not going to go to the surgery center.
Right.
But when we can, then we should. and the cost of that is incredible. I work very close with Brian Townsend with some of these issues that we have, and he was willing to listen to our problems. And the issue that you see is, there's something that is paid $1 to this organization, and that same service is $6 on the other side. Now, just put it in perspective, and then that's my kind of classic example of gallbladder surgery. That's for a Medicare patient is $2,800 in the surgery center. In any of the major hospital systems in Delaware, that's about 16,000 to 18,000 average. So that's making the private practice business very difficult. And my big problem in terms of course, like, we are a business, that's in the pocket, so that's no problem. Problem is when I'm not doing what I'm doing, then things are going to be more expensive because our people are going to join the hospital systems, and the hospitals are becoming now primary and outpatient and the inpatient. So then things shouldn't be that expensive, are going to be more expensive. And all those actually kind of triggered our, it kind of motivated us to have these conversations so that we also, I mean, please don't take this in the wrong way. So you're a lawyer, so you're
recovering
lawyer. So you are not a healthcare provider. But then, and I say this to Brian Townsend, he's a lawyer, and he's not recovering. And I tell him that, look, this is a primary care bill. So why are you doing the primary care bill? Well, because no one else is there, right? So then I tell everyone that our job is to make sure that we work very closely with our elected officials to make sure that they fully understand what we go through. And I think we really accomplish this, especially with the Senate Bill 1 discussion, and the whole process was amazing. And it was challenging. I thought there was a point when I see, hospital bringing, 40 people with white coats to the Senate hearing, the House hearing. It was concerning because we didn't have anyone because they had to work, so they had to do the payroll. So anyway, so that's kind of like there are a lot of opportunities, and I think good understanding of what needs to happen. So I want us to be able to continue on our discussions on different things that we can do. And one important thing is we know that we as individuals, our employees, our other population, they are also responsible. Individual is responsible to do certain things. Now we provide, the healthcare to our employees. And last week, or was it this week, we had the business office meeting with all employees in a Zoom. And, we failed on all the prevention metrics. And, my message to them was, look, if we don't take care of these, how am I going to actually convince the insurance to not to increase our premiums? So, and that's why we are trying to talk, and hopefully people will change.
Well, at least you're having the conversation too. I mean, there are many well-intentioned folks and businesses and leaders who don't even have the conversation to look at the data and just be self-reflective and go, we got this right or we got this wrong. I'm telling you, we can walk and chew gum at the same time. And, again, why conversations like this and shows like this are so important is because when I'm at doors or in civic association meetings, they expect, rightly so, for us to figure some of this stuff out. Drop the jargon, and when something costs $5 here, but $555 over there, on plain spoken, on its face, that does not make sense. And they expect us to find an answer to that, and then to be able to communicate it back as well. And so it's incredibly important what you're talking about there, and some of the ways we've been able to demonstrate how we can do what we're called to do, particularly when we're in elected official positions.
So now, in terms of the healthcare provider shortage, this is a huge problem, and we are trying to hire people. I know everyone is trying, and in the old days we used to get more applicants. Now it's more like we are not even getting applicants for the physicians, and well, mainly physicians. We still have a good source of flow for the non-physician providers, but The medical school is kind of promising, so that was one really positive news recently. But from your perspective, what role should the state government play in this in supporting healthcare workforce?
I think it's incredibly important for certain in the bullseye around attracting and retaining the best talent that we can from a
Hmm.
physician perspective. But also we have to realize what the reverberation effect of that is. When we do a better job with that,
Hmm.
we're also then and therefore creating additional workforce opportunities for folks that support and work with physicians, for folks that will move here and buy a home here, for folks that when they buy a home here, then they'll go out to dinner. There's a reverberation effect on what our culture is like in our neighborhoods and across our different geographies. So for the very obvious reasons, but also for some of the additional, frankly, economic development perspective, it's
Hmm.
incredibly important as well. So it's good to hear that news. I want us to hold solid and true and keep ourselves accountable that that's going to happen in Sussex, and that the community stays engaged as well down there because it's an issue larger than Sussex,
Hmm.
and so I'm glad that folks are engaged across the state.
Right, right. Now, I want to talk about your your main full-time job as the Chief Operating Officer of
Yes.
United Way. Uh, what does United Way of Delaware do? Just a brief background on that.
Yeah, sometimes the easiest way to say that is what do we not do?
Yeah.
Sometimes when you do a whole lot of things, it's hard to describe what it is that you do. So, United Way of Delaware is a part of the United Way network. That's a
Mhm.
global network. There are literally United Ways across the entire world. Clearly, there's a concentration in the United States. Every state has a United Way. Most states have multiple
Mhm.
United Ways. We're a little bit smaller. Delaware and Rhode Island are the only two states that have one statewide United Way.
Because we are always competing with Rhode Island
You
anyway.
know,
So,
it's
are
it,
we number one or number two?
We are number one.
All
Let me be
right. So
very
that's
clear. Coming from the first district in the first state, we're certainly number one. United Way does a number of things. The easiest way to describe United Way, I think, is that we help people. And
Mhm.
what I mean by that is United Way raises money to invest in programs, raises money to invest in organizations.
Mhm.
We are on the ground with some of our partner organizations running direct service programs. Everything from this United Way, it comes from a collective impact model, which can sound a little jargony, but what that means is that we are never doing anything alone. We are always locked arms with individuals or organizations hyper focused on what we call grade level reading, making certain
Mhm.
that our youngest learners are on grade level by the end of third grade. You and I talked about preventative healthcare earlier.
Mhm.
That's preventative education. There's a direct line
Right.
between not being on grade level by third grade and your future success in
They need
life.
to be able to understand what they are going through, of
Oh,
course. Yeah.
100%.
Literacy. Yeah.
And then making certain also that that our adults are thriving. So you mentioned earlier, we are the home for the Delaware 211 helpline, which if you're bleeding, call 911.
Mhm.
If you have a social service emergency, if you are having a hard time with your rent, electricity, you can call us and we'll make certain that you get to the right referral resource. And we're also running programs to help adults not have that same problem. If you are food insecure, we're going to make certain that we get you food. We get you to the
Mhm.
organization that can help you, but we don't want you hungry again. And so I talk often about give fish and then teach to fish. The teach to fish is we also invest in programs and run a program with the state that helps folks rebuild their economic muscle,
Mhm.
improve their credit score, reduce their debt. So we're working with different populations, different age groups, with different community-based organizations up and down the state in different neighborhoods. So we're on the ground, we're kind of grassroots, and then sometimes we're grass tops as well.
So, because we didn't spend a lot of time prior to this, so I'm a board member, actually the vice president of the board of Brandywine Valley SPCA,
Yes.
and been working with YWCA for a long time since 2012,
Yep.
and we started a resilience fund this year. Um, the goal is to raise $1.5 million because of all the cuts that we have from the federal government. Uh, this is affecting all the nonprofits, and what you are seeing from the uh, just don't give them the fish, teach them how to fish. That's what one thing that YWCA does really well.
Oh, they do a phenomenal job.
And it's the transitional housing is what's called, and when they need the most help, not permanent, but just let them go through that time, get the proper support, safe place to stay, food and other things, and but also learn how to cope with the issue that they are going
That's
through.
right.
And recently, I became the board member of the Food Bank of Delaware.
Oh, that's
So
great.
now, when I was preparing for this, I'm like, well, I should have talked to you several weeks ago with a lot of these things, because there's a lot of common things
Yes.
these organizations that I represent, they do with United Way. Now, we have two social workers here with the social determinant of health. We try to help our patients to, find the proper sources, because a lot of people don't know what options they have or what's available to them. They don't know. And social workers were probably one of the best addition. Like, of
Oh,
course,
yeah.
everyone is important, fine, but they were unique in a way that we didn't have that type of service.
It's like a navigation role almost in
Right,
some ways.
absolutely. And then I do case conferences every day with our two different groups, the nurses presenting cases, and then we have pharmacists and the social worker, business development, and half of the time, the issue is not about what's available to them. The issue is they have a lot of other problems. That's not like getting the colonoscopy screening is not on top of their agenda,
Oh my gosh.
because they have to make it through the end of the month. So this is the reality, and there's single mom with 3 kids struggling with a job that pays not enough, and we are telling her, well, you need to get your mammogram done every year or every 2 years. Like,
I'll get to
how?
that when I
Yeah,
can. I got to keep the
right,
lights on.
right. So that's kind of like this. It changed a lot of things for me, and better understand in terms of what we are trying to provide for these. Now, food is medicine is one
Yeah.
of the initiatives that we started. It first started with Food Bank of Delaware, and Lieutenant Governor Kyle Evans-Gay is leading the state initiative. And YWCA has something with food is medicine. Now, it's kind of a buzz term these days. Food is medicine. Food, like, it's kind of like,
But it
oh,
makes you ask the question, like,
yeah,
tell me more about
what,
that. That's
yeah,
what you
right.
want. You want
So,
someone to
but
ask.
everyone wants to do something about it, right? So now your organization is also doing some of that, right?
We
So
are.
are
We are.
there some like collaboration opportunities between these organizations and the United Medical ACO to increase our potentials?
Yeah, 100, 1,000, not even 100, 1,000%.
Hmm.
When you mentioned, actually, all of the organizations you mentioned, but one of the last ones you mentioned was Food Bank of Delaware. Clearly, they do phenomenal work. But when I talked a moment ago about 211, about giving fish, and then programs to teach to fish, the program I was referring to, I didn't name it, is the Stand By Me program. And Food Bank of Delaware is one of our initial partners. This is 15 years ago. We just convened folks maybe 6-7 weeks ago, and Kathy, the CEO, spoke there. And then in return, when they were at the General Assembly with their day, I spoke with Kathy on the steps of the General Assembly, because we're coming from the same place.
So
We
you
have
were at
Stand
the
By Me.
dinner, the mission dinner for Food Bank?
Yep,
I
exactly.
was there with my team.
We must
It
have
was
passed each other in the
it was
night.
really hot that day. So.
It was incredible. We were trying to hold it together, but
Right.
we were very a little extra
Well,
wet.
they had all these AC units, internal AC units, but
Yeah.
it wasn't helpful. But one thing that Kathy was saying that night, we were complaining about, the heat. It was in the evening, and we are not working. We are just getting food and just socializing.
Perspective.
And people, like 5 hours ago, they were actually doing actual work
In the sun
in
during the
and
day.
then they didn't have the AC units.
Right. It's a good
That
Kathy.
always
The
brings
way Kathy
me,
brings that
yeah,
perspective is
that
so
right.
profound.
That always puts me back to my space. I'm like my place. I'm like, okay, so I cannot complain.
Yeah, well, but it's good to check ourselves, and it also that work, this exchange, our work with Food Bank, my work at United Way, it really grounds what I do as a state senator as well, because I feel so lucky, so humbled that when we're having debates behind closed doors about a bill at the General Assembly or in our Senate Democratic Caucus, For me, the conversations and the implications of what we're trying to do, it's real. I've walked in the neighborhoods. I've worked with the hyper local organizations. I've learned from all of them and all of that. So it's very tangible. It's not theoretical. So I say this often. I'm such a stronger elected representative for my neighbors because of my United Way role. It's not theoretical at all. And I talk all the time about it's never me, it's we, and that's not meant to be like a catchphrase. It's to your point
not.
earlier, like there are fantastically intelligent, experienced folks in Senate District 1 that have done things I've never done and I'll never do. And the work that I've been able to do at United Way with United Way just makes my ability to bring the voices of my neighbors, your neighbors, our neighbors to the table that much more specific. And I think that's good for democracy.
And you know, like when we have the inside information, it's again, it puts more responsibility.
It does.
Not everyone would know what's going on, and you know, every time we see people homeless, and then we see people in the bus stop that they live there, and these are reality. This is happening. So this is happening today. So you know, every time it's tough to drive by those people and not to be able to do anything, and or like what I want to do, at least like in many cases, and then you know, a couple of my directors tell me not to, is I want to just talk to them to see if they know where to go. Like, and then they're like, no, 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 don't. They just call someone, because there's also safety issues. And we like, while you are kind of struggling between what's right and what you really should be doing, logic, like the brain and the heart just fighting, that's not really ideal. But we live in this society, and we all have responsibilities, and the peaceful society requires us to really understand each other's problem. And one thing that I always say, and then probably people who are following us, they hear this so many times from me, is United States is one of the best countries in terms of the nonprofit organizations and how effective that we work, and because we are not expecting everything from the government, individuals are helping, organizations are helping, and that culture that we have in this country is amazing. So, you know, I'm always thankful for that.
Well, I'll say just one quick add on to that. Yes to everything you said. And in my current role as a state senator, but even more importantly, when I was the deputy secretary and chief of staff at the State Department of Ed, a huge state agency, before I ever worked at United Way. What I knew then, I know most profoundly now, and you were saying this, our nonprofit sector, it's an extension of state government. It's an extension of how we in government help people. Right. And I want to say that out loud and then underscore it every chance we can, because nonprofits are not charities. That can be perceived as a negative word. Right. We are literally helping people, and we're helping people that you think need help, and we're helping a larger population. I talk about the Alice population often.
That's coming up.
And so there's a stereotype of who United Way helps, or who is on state benefits, or how DHSS does their work with nonprofits. I want to believe that almost all of us lead with caring and compassion and empathy. Don't have rose-colored glasses, but I want to come from that place when we have conversations with folks, and some folks that are watching and viewing, the folks that you think we help, yes. And this ALICE population, which is an acronym, which I know is jargony. I'm wearing it today actually too. Where's the camera? Zoom in.
Yeah, tell me about the pin right there.
I wear this all the time, every chance that I can. Because what I want people to do is I want them to ask me, what is that? What is that? It's a conversation opener. Well, that's a good one. I get it. Sometimes I have to wear the Senate lapel pin, but I do this for that exact reason. It's an acronym, so I should say that out loud first. Asset limited, income constrained, employed. That E at the end of ALICE, incredibly important. These are folks, sometimes it's called the missing middle. Sometimes in years, maybe decades ago, we called it the working poor. That can have a negative connotation. There is no negative connotation to being ALICE. This means that you are working your hardest and you're barely getting by. I didn't come up with ALICE. Delaware is part of a national network, 35 plus states generally associated with a United Way, but not always. There is a formula for how you find yourself in that population or not, as an individual or as a family or as a senior citizen, et cetera. So this isn't just a phrase or a set of sentences. And so it's data driven. And when you look at Delaware and you look at the calculation of what brings you into the ALICE population, when we plan a lot of our benefits in this state around the federal poverty level, I won't get, again, too jargony. That's important, but that's maybe 10, 11, 12% of our population. Important. They need our help. We need to help them. We're missing the next rung up, our ALICE population. When you look at folks that are at or below the ALICE threshold, it's at or over 40%. 40%. So when you think you don't know who needs help, you do.
Medicaid population being 30% of the state.
Plus, and so, what we do with this is it's not just to socialize who is in need, it's to help us realize that we, from a government perspective, from a nonprofit perspective, from a human being perspective, there are so many folks that need a hand up, not a handout. And that's some of the work that we've been working on. These are folks that are sometimes our educators. They are certainly our paraprofessionals very often. These are folks that work in our building that we're in today. We know who's in need. We just maybe don't know that they're actually in need, and the ALICE work actually brings that to bear. And we've been working on legislation to try to make government work for ALICE. Government doesn't unintentionally not work for ALICE, but it requires folks that are having this conversation that then can sit down with state agencies or fellow legislators and move legislation forward to say, we don't need a benefits cliff, we need a benefits glide path. And that may be jargony too, but there are just things that we can do that help ALICE get ahead. There are some cases where ALICE may not go after a promotion or take a promotion or work extra hours in the summer, because if you make $10 more, the benefit that you had, maybe for example with childcare, you lose it. Doesn't make sense. That's a reverse incentive. So I won't go down the rabbit hole, but there's a lot of work.
Those are real time. I mean, here's the issue. Who's deciding in our elections, from the people who are voting? I don't see, and I may be wrong, but in the primaries, I'm not going to go to any specifics of the candidate. I'm looking at it from the people who are voting. Are not those who are struggling, like the way that you are explaining in the ALICE, that family or that individual with kids, they're not going to go to the primary.
Right.
They're not going to go to the November election. They can't. Right. So this is one of the issues that I did compliment United States and give a lot of credits for nonprofit, but one issue that I see is how little interest we have in politics and who's managing and who's leading our societies. And we do need to really better understand, and that's again whole purpose of these discussions is if that person understands, maybe they will watch one of these one day and then they will pick it up, or someone else will explain it to them. They really need to go out there and vote for their future, because the problem is they're not there. They're not decision makers. So we have all these good things that you are doing, we are trying to do from our side. But then if your people that you are supporting are not able to go to the voting, then it becomes difficult, because you have to be elected. Yours is 4 years, right?
Correct.
So it's worse if you are the rep. That's every 2 years. There's so much anxiety. You can't really work. I don't know how they are doing it, but the 4 is good. So you're not up for this November?
I am, because I came in when Sarah McBride became our congressperson. It was a special election. So one way to think about it is, out of her 4-year term, I kind of came in year 3. Is one way to think about it.
2 and 3, year 3 and 4, you are completing.
So I have a general election in November, and then there's a primary, and that primary will be in September.
Who's primary?
I have a primary.
Who? You don't need to mention the name.
I have a primary.
We need to know those things, people, team. So there are a lot of people here. They should tell me these.
That's okay. That's quite all right. I mean, look, we live in a democracy, and it's important.
Sometimes I don't get this whole primary thing. If it's close, I can understand, but In some, it's just a base, but
We're working on it. We're working on that. And to your point earlier about voting and the folks that we're talking about now, our Alice population, I think one of the most important things is that if they're watching or they hear or they have friends, I want folks to know that they're being heard and that I and others are carrying their voice literally to try to make change at the policy level. Some of that policy change is also about trying to make it easier to vote. Plain and simple. You made a very good point about some folks that I'm talking about that we're providing legislation for around Alice, they don't have the time to vote. They're on their third shift, or if they go get in a line and the line's too long, it is not designed for this population sometimes. So we have moved and will continue to move legislation to make it easier to vote.
or like do it on the weekends, the elections.
There are so many things that we can do. I joked earlier about walking and chewing gum.
What's so special about Tuesday? Do you know the history behind that?
History. But you know what?
Tuesday,
We can pull down some of these walls. We can make it easier for absentee voting. There are things that we can do. I joked about walking and chewing gum earlier. I mean that. You made an incredibly important point. I'm moving with my colleagues legislation to help Alice get ahead. We also want Alice to make it easier for Alice to vote, for anybody to vote.
Right. I mean, that's the key. Like those people, they have different priorities in life, and then they're like,
Sure.
oh, am I going to be able to take time off? But if it's on a Sunday or Saturday, at least they would have an opportunity.
Which is like your colonoscopy reference earlier too, right? There are things that you need to vote, you need to have your colonoscopy.
Right.
But okay, that sounds great, Dan. But when? And it's a legitimate conversation. And so we together, your industry, my industry, our industries, we're trying to make things easier for people because that's common sense. That's what we're trying to do.
Like we should be able to figure out more efficient ways. But I don't want to forget this. You mentioned the benefit cliffs, and you did sponsor SCR 102. Let's talk about that one. So that was part of the Alice developments. So can you kind of explain us what was this benefit cliff that you were
absolutely I made quick reference to it earlier when I won the special election. By the time I got sworn in last session, I was only in session for a couple-ish months, but what I wanted to make certain that I did is to begin to make a mark for exactly what we're talking about. My neighbors who are Alice, my folks who maybe they live in the district that have been, are, or have loved ones who have folks in this population. We moved that piece of legislation forward. So a benefit cliff this is the under explanation of a benefit cliff. If you receive a benefit and it's tied to how much you make to your income, when you make $1 more, the way some of these benefits are set up is you instantly lose the entire benefit. So if we think about childcare assistance, which by the way is the number 2 most expensive driver on the Alice survival budget, it can be more than college. And so when you think about
doesn't make any sense.
Exactly. And so childcare assistance is not a handout. It's an investment in you as someone with a child or children to say, we believe in you and we want to help with this. Our society wants to help with this, with childcare, so you can fly and become everything you need to be. It's not nonetheless, I'm on my soapbox a little bit because some people prejudge benefits or a benefit like that. I do not. I know you do not either. It's an investment in society.
Well, these are real life issues. Like people are dealing with it, but the problem is selfishly we don't want to see that problem until we face one. So I think that's kind of
exactly right. And so the benefits cliff is you receive this benefit and it's the right thing to do. And we just talked about why it's the right thing to do. You make $1 more or you work an extra hour. You instantly lose the whole benefit. So there's a disincentive to get an extra degree or to pursue a promotion or to work extra hours during the summer, whenever it might be. That's a perverse reverse incentive. And government wants to do good. Again, I was a part of government before. I get it when I was at the Department of Ed. And so in this case, this benefit is at DHSS. And so the legislation called for DHSS to work with me and work with us to, instead of have a cliff, think about a slide, think about a glide. And so there's an ease off of the benefit as you make more. There is a step down to the benefit as you make more. So there's a little bit of more balance in your life. Again, my neighbors, your neighbors, our family members expect government and us who work with and help government do its best to bring some common sense solutions, particularly in this case to an Alice population. And so DHSS was wonderful. They have worked out a glide path for this particular benefit, and that'll be the model for us to continue to work together because government can, should, will, I'll make certain that it works for us, particularly for our population that's again, in some cases over 40% of Delaware. And so I'm glad that you brought that one up. That's important for all kinds of reasons, but that specific example in
So
particular.
while we are talking about this population, I think the one of the biggest concerns that we have is the housing affordability. We
Yeah.
kind of mentioned. I mean, do you see what do you see as the realistic solution to that?
So if I could answer your question with like a single sentence or three, I would be a billionaire. And that's not to avoid an answer. I think I look at this as almost like a 12-layer cake. There is no magic answer.
Mhm.
There are multiple things that we can do as government, we can do as individual citizens, we can do as nonprofits as well to move towards a more equitable solution to the housing crisis. Legislation moved this session. Senator Russ Huxtable from down south
Mhm.
moved legislation forward to work to have municipalities. I'm going to under-explain this one as well. Look at their comprehensive plans. In some cases, look at zoning to make certain that we are moving policy at the local level forward that opens up opportunities to have to have a different types of housing structures. That requires zoning changes and that requires community input.
Mhm.
That also requires, in many cases, technical assistance from municipalities that want to do the right thing, but maybe they haven't done that before. So we have moved legislation that will help them do that. I think that's one piece
Mhm.
of a very deep 12-layer cake. I think we also have to look at how, as individuals, we are helping ourselves get prepared for home ownership as well.
Mhm.
And so we talked a little bit about Food Bank of Delaware and the Give Fish, Teach to Fish earlier.
Mhm.
That Stand By Me program is incredibly important to help me as I was going to say a young person, I'm not young anymore,
We are
but to
young.
help an individual or a family get themselves mortgage ready.
Mhm.
There's a lot more work that needs to be done. I think can happen from the state level as well and the nonprofit level. And so we kind of need to come at it from multiple angles. I'm using that cake analogy way too much today. But one of the most important aspects to this is that it's not something that's talked about only in housing policy wonk circles.
Mhm.
It's happening every single day. A third piece to this puzzle is what it costs when you're in a home. So if you want to, I could talk all day, which I won't, but about property tax reassessment. My gosh, that was
Yes.
something that was quite the fiasco. And so for
That
folks that
impacted a
live in
lot. I mean,
homes to be able
like
to
for
stay in
everyone.
homes,
Yeah.
what happened made it next to impossible for some folks. So I moved legislation at the beginning of session in January and at the close of session with my colleagues to make certain that common sense things can happen to help reset some of that work.
Mhm.
And that's an incredible piece of the puzzle. It's not just moving into your first or making your first purchase. It's retention in the house. It's about thriving in your home as well. So there's a lot of different things that
Right.
need to happen. And I'm happy to say that we're walking and chewing gum. We're working on all pieces of that.
You know, it's interesting because even John Connor was complaining about this real estate taxes,
Yes.
and he was giving examples from his own home when he was here on the show. So that's just totally mishandled. But right now, it is what it is, I guess.
Well, we're straightening some of it out at the county level. I moved legislation in January. Again, this is just common sense. Think about small businesses versus big businesses. So the corner barbershop, I talk about Mr. Holiday's corner barbershop in Bellefonte. When his increase was thousands, was a multiple thousands of a percent, and then you see a very large business. We don't have to name a name, but they have $1 million decrease.
Mhm.
That just doesn't make sense on its face. And when it can't be explained, I'm not blaming the county at all.
Mhm.
I'm blaming the technology company from before.
I can blame the county.
No,
On
you
your
can do
behalf.
that. Well, I will tell you, you've been working in an incredibly collegial way with County Executive Henry and his team. They've done
Well,
phenomenal
this was
work.
before him.
It was.
Yeah.
But so we moved legislation to go, no, you have the authority and the resources to redo that work. And that work is being redone. And that is paying off because what large businesses should pay, we're getting closer to that. So we're fixing things, but we're doing it with the county because it's a county function.
And even for the business real estate, the commercial side of it,
Mhm.
it had a like huge impact. Like,
Oh gosh, yeah.
like I didn't actually realize that. Like we were all focusing on the home, the housing tax, the real estate on the personal side, but the commercial was like brutal. So
Yes.
that's going to impact the rents. That's going to impact everything else. So Yeah,
There's
there's
a lot
some
there.
we need to fix that. So
We're,
now,
we're working on it. Hear me loud and clear. We've moved legislation. It is far from perfect, but the county is working very closely on all of that with us.
so one thing that I wanna ask you. Chris Coons was here about a month ago, and I asked him if this is the most kind of both sides, like how bad we became maybe between the two parties, and then his answer was kind of interesting. He said, "No, it's like this used to happen in the old days too." And for him to be still very optimistic is miracle, amazing. So, and I saw something the other day. We have two Michael Smiths in,
We do.
so and they look alike. Like I can't tell which one is which. Am I the only one who thinks that
Keep
way?
going. Keep going.
So, and one of them is a Democrat, the other one's a Republican. And I saw this post from the Republican that's actually supporting the Democrat.
Hmm. Yep.
And at first I thought it was maybe like his account was hacked. And then just sit back and then process it. I'm like, nah, well, we have Mike Castle in the old days. He was kind of in the middle Republicans. He was closer
Hmm.
to the center.
Moderate.
And how did you process that? And then the follow up to that is, what keeps you optimistic for the future?
Good. Two very good questions. I will say one thing I'll say is moderate isn't a bad word. We could spend a whole episode on what moderate means and doesn't mean. I will tell you, and this is part of human nature, and shows like yours do such a nice job of illuminating more of the reality, not just the headlines. What makes headlines or when we in this state, when we just rabidly disagree, that's going to
Hmm.
make a headline. Republicans versus Democrats. That's the minority of the time. I've moved a lot of legislation in my short time as a state senator, and it's completely bipartisan, almost all bipartisan. Or
Hmm.
my Republican colleagues stand up and sign on as co-sponsors. My Alice legislation stood up and signed on as co-sponsors, didn't just vote yes. Now, hear me loud and clear. There are times when I have moved certain things forward, and that is not the case. So I'm not being Pollyanna. But I will tell you, the vast majority of the time, we're coming from similar places, or we land, maybe that's what I should say, in a place where we agree with each other on most things.
Hmm.
Shows like yours help to illuminate and give me the chance to speak into the microphone and look into the camera and say, that does happen. Not happening at the federal level. I
Hmm.
get it. I respect Senator Coons immensely, and his optimism is incredibly important because that is what keeps folks alive in these
Hmm.
political debates and in these political conversations. And it's true. Part of what keeps me optimistic, which is part of your question, is when I have the chance, and I believe this is what Senator Coons likely means as well, when I'm at the door talking to somebody, when they actually open up and give me a few minutes of their time or tell me to come in and sit down and have a cookie, which actually happens, um, they have they have hope, and it's not Pollyanna hope. They believe that, at least in this case, that I'm carrying their voices to the table. They see what we're doing, and they know that we don't agree all the time on all issues, but they know that we're listening, and they know
Right.
that we're trying to make the best decisions. There is hope in the field. There is hope in our district. It's independents, Republicans, and Democrats, and unaffiliated folks as well.
Hmm.
That's what I'm optimistic about when I talk about the Alice population, and I have 9.9 times heads bobbing up and down because they are or have been. That's my optimism. That's what keeps me moving, because that is the majority of our neighbors.
Well, I'm always optimistic. Sometimes people say like, "Why are you always happy?" Or like, then I think that Dr. Ergan, who's gonna be with me later
Mhm.
today with the YouTube show, so he's even more optimistic than I am. Like sometimes when I'm down, like he's like, "No, come on, you have to see it this way." I'm like, "Oh yeah, well that actually there's always a better way."
There
Then
is.
when you look at what people go through, well, the difficulties we go through is not that important, maybe that, or it's not really even major. So a lot of people went through bigger challenges.
Well, people believe in people too. If I
Right.
if I answer your question with my United Way hat on as well, um, people that make the least give the most
Mm.
through the United Way system. There are workplace campaigns. If you're company X, you have the
Right.
opportunity to share $1, $10, no dollars every paycheck just to help people in need. Those that make the least give the most. That's something to hold on to.
Well, Senator Cruz was with us. Thank you for joining.
Thank you for the opportunity.
And I remember in the beginning, I told you that this was going to go very quickly. So it's
It
almost
did.
1 hour. These issues that we discussed are very important, and some of them are personal for me. Some of them are the responsibility that I believe I take, and for you guys to come to these shows and then, explain your side of what's happening, and hopefully maybe reaching out to more individuals is kind of one of the keys these days that we are trying to do. And I know election midterms coming, and then there's a lot of people who are running. And one of the other things that I want to mention is we are open. One of the Republican Senate members, he was in the show in June, or maybe it's May, look, June. Eric,
Senator Buxton.
Buxton, yeah.
Oh yeah.
So, and we had a great conversation.
Yep.
So this is the reason that we are doing. But when you guys are participating, it makes it even more fun and more efficient. So thank you for being with us today.
No, it's my pleasure. Thank you for doing this, not just for us, but for society. Not to be too pie in the sky. I think it's important.
Thank you. Well, we'll be back with Bariatric Friday at 3 p.m. So until then, please stay united. Bye-bye.